Paul Waugh from the Huffington Post.
Health Secretary, as you've frequently said, the long-term solution to this pandemic is a fully scaled-up vaccine for COVID-19.
Yeah.
But a vaccine relies on as many people as possible actually taking it up. Now, you told HuffPost last year, and I quote, "There's a very strong argument for having compulsory vaccinations for children for when they go to school, because otherwise they're putting other children at risk." Would that apply to a COVID vaccine as well as to MMR and other vaccines? And what are the measures you're looking at to ensure as many adults and children take up the new vaccine when it's available? And if I can, to Professor Van Tam, can I ask you what you've made of the early academic research done in Harvard, Germany, and even Cambridge that suggests high levels of air pollution may be one of the most important contributors to the clustering of deaths from COVID-19? Is SAGE looking at that or going to look at that?
Thanks, Paul. Two very good questions. On the vaccine, the first and most important thing is that we support the development of the vaccine, and you'll have seen the Prime Minister's excellent announcement today, and then that we also do the work to ensure that people can get access to the vaccine, starting with those who are most vulnerable. On the question of whether to make it compulsory, I think that the extent of the public's reaction to following the lockdown shows that we will be able to achieve very, very high levels of vaccination without taking that step. And so our task is to ensure that it is, in the first instance, we support the science as much as possible, because we can't assume there'll be a vaccine. There is no coronavirus vaccine yet. For any of the existing coronaviruses, and this is uncertain science. But whilst I don't rule anything out, we're proceeding on the basis that just such a huge proportion of the population are going to take this up because of the obvious benefits to individuals and their families and their communities and indeed the whole nation, that there'll be enormous demand for it as and when the science is safe to proceed.
Yes, thank you, Secretary of State. So, just to stay on the vaccine question for a little longer, we are following the developments in vaccine research across the world, including in the UK. We remain very hopeful that there will be a breakthrough at some point in the future. I think what I can say to you is that it is more likely than not that the first vaccines will be licensed in adults in the first instance. And therefore, one has to put some caveats around your question around children. And the other thing to say is that so far the epidemiological evidence is not showing us that there is a massive burden of disease or burden of mortality in children. It is actually completely at the other end of the scale. It is in the elderly. And so from that perspective, again, that's another caveat I'd add to your question about vaccinating children. On the second question about air pollution, and thank you for that, I think we already have very solid data that air pollution contributes to a whole range of mortality, particularly from respiratory illnesses and respiratory diseases and cardiovascular disease. I have heard it said about air pollution and COVID-19. I have not personally studied those data and looked at that question in detail, but what you say is entirely plausible in my view. Professor Newton may have some further observations on air pollution.
Well, no, only your general point that we know that air pollution, because it's so pervasive and affects so many people, has a huge burden. But like Jonathan, I haven't looked at those papers, but I think it's something that we
right. I think we'll get back to you, Paul. Is that the scientists will get back to you?
Yeah, just one brief follow-up, Secretary of State. Do you have a message for those anti-vaxxers here and abroad when and if we do get a vaccine for COVID-19?
Well, I think there has been no greater demonstration in modern history that vaccines save lives than the need for a vaccine to save lives and to get the world going again following the outbreak of COVID-19. And we will only license a vaccine when it is both effective and safe, and when the independent regulators, if and when the independent regulators license a vaccine in this country, they will do so knowing that it is safe, and everybody should follow that. Everybody should follow that advice.
That was Matt Hancock, then the Health Secretary, joined by the Deputy Chief Medical Officer Jonathan Van Tam and Professor John Newton, the Head of Testing at Public Health England. Worth saying, by the way, if you live on the Isle of Wight, are you planning to download the app and take part in the trial? Maybe you are, maybe you aren't, but do let us know. 85058. Get in touch and let us know where you stand on it. Let's talk to Ian Watson, our political correspondent. It was in the main all about this.